Hello, good evening, everyone. My name is Faran Mansoor. I'm a fourth year medical student at Medical University of Americas. Um, I, am a class of August 2015. A little bit of my background. I immigrated from Pakistan at the age of 12. I've been living in New York since then. Um, I did my undergrad at Farmingdale State College in biology, and and sophomore year of college, I did join the Army National Guard of New York as a military police officer in the reserves. I signed a 6 year contract, which just recently ended. Also, before going to med school, I was also in a pharmacy technician at Walgreens, and I started basically medical school in 2015, and few of the questions the admission teams usually get, I would like to answer that. But a little bit more of my background, I'm a clinical student right now. I did internal medicine rotation, surgery, psychiatry, pediatrics, and OB-GYN. On the electives, I have done ICU, cardiology, ambulatory medicine, and I'm about to begin emergency medicine in July, which is coming up. So again, this is a video or this is a live session for the students who are interested in MUA, and I just want to answer a few the frequently asked questions that students usually have. And me, when I was a student, I had a lot of questions as well. And I think the first thing to start off med school is by researching into what school you want to get into, and that's how I began. And I hope you will watch this video and people get something out of this. So I would like to begin with a few of the frequently asked questions that students have usually. So the first question is, how did you choose MUA, and what went into your decision? So in 2015 in January, I started looking into what medical school I want to get into. Um, I didn't do as well on my MCAS. I had a great GPA, but I always wanted to pursue medicine, so I started looking options in the Caribbean, and I looked at the top schools at the time, and with my research, I found that the MUA was a great option for me because of the small class sizes that they have, as well as the tuition was affordable, um, and I was something interested in. I like interacting with the professors and with the teachers. Um, so that's why I wanted to go to MUA. And also they had the federal loans, the Title IV loans, which is really helpful if you are looking into going to medical school overseas or anywhere. But Title IV loans are really helpful. And I read really good reviews about MU at the time. They had a great passing step one score, as well as a residency placement. So it was me and my other friend, and we both basically started medical school together at MUA. So another question that student coming has is, how was the transition to MUA from the undergrad or from whatever you may be doing previously? So island life, can be it can be tough, but any transition in anything can be tough. But just have to look at it as one step closer to your goals and dreams. And for me, I got onto the island, and it's really hot. I mean, it is the Caribbean, that it is the temperature is really high, so you have to get used to the hot temperature. But me and Buddy used to carry an umbrella, which was helpful. But you have to realize that you are getting yourself into a new location, a new goal, a new dream that you want to pursue. So depending on how much you want this transition can be really easy or difficult. It just depends on how you look at it. Um, for me, I I wanted to pursue medicine. I wanted to become a doctor, and for me, it was I was gonna do it regardless of what the temperature is or how anything is. So for me, the transition wasn't as difficult at all. It was really easier than I actually expected. Um, so another question is how's the island life, how's the living, housing and food. So when I got there, the school does provide housing if you are interested, but there are other options depending on your budget and what you can afford and what you cannot. So there are places for everyone. Just really depends on what you want and where you want to live. You want to live close to school. You want to live with little distance. Um, Transportation can be difficult, but there are people who rent out cars, their vehicles, and you can rent them with with your pals or with your friends or someone. You can share, and it's easy. It's affordable, and that's what I did. It was me and my four other friends, and we shared one truck, and we used it for about 2 years, and it got the job done. Um, Food wise and groceries wise, there's a lot of restaurants there with a lot of beautiful views. I think it is one of the most beautiful island. Not been to that many islands, but it is one of the most beautiful places I've seen. Um, there are grocery stores nearby. Doesn't matter how far or close you live. There's always somewhere you can do groceries. There's cafeteria at the school if you want to eat at school, at campus. They provide um, breakfast, lunch, dinner. And they have halal food. A lot of Muslims I know have that question if they have halal food or not. That's one thing that they do have. They do provide halal food as well. Um, but there's good options. I actually did personally like and did enjoy the breakfast there every single day. Um, so they have everything that you need to succeed. Everything is there. Um, and a little bit about like the basic sciences program. So when I joined MUA, they recently have adapted the U.S. Curriculum, the U.S. medical school curriculum that they had, which is a system-based curriculum, and we were the second class where they implemented that, and going through the basic sciences, it is tough, it is difficult, it's long days. Our day would start usually around 7 or 8 and last around until 5 p.m. But then you always need to go home or go to library or wherever, but you need to put in time after school as well. Um, but the system based really does let you um, learn about each system in detail, and they do a good correlation, um, with the foundation of the subject as well as how you can use this in the clinical life. Um, it is basic science, so you don't see any patients, but they do a good thorough job by connecting how the basic science component can help you succeed in clinicals. Um, and like I said, it is difficult. You have to put in a lot of time and effort, and just a little thing. So when I was in the basic combat training in the army, um, you know, there's a lot of recruits that who gets into the army, and not everyone makes it. But few of the things that our drill sergeant used to always say that the students previously or the recruits previously, I should say, have made it. So why can't you? So it really depends on you um, how much you want it, how badly you want it, but the school provides a great curriculum, and you can, in the end, you can pass your board, you can ace them. I know a few students who have gotten grades or scores that are unimaginable, I feel like, for a lot of med students. So is this MUA really does provide you with a great curriculum, with great professors, um, and all those professors are, they are expert in their subject. They know what they're talking about, and they're always available if you need any help. They are there after the classes are over. You can make appointments with them, but they're always there if you need any assistance of any kind. If something that is, not clarified during the lecture, you can always get back with them, and you can always go back and talk to them, and they will be more than happy to help you with that. And they're all really nice, and I think I, met my my favorite or best mentors in my life at the island, and it's just that learning from them and knowing what they go through, and uh, why they are there, or what they are teaching, um, is a lot. You can learn a lot. So it all really depends on, how much you want to give in, because there's a lot that can come out of these lectures of, professors, of their experiences, because most of them are, have a lot of experiences in their field. So you will not be disappointed if you have a question, because they will be able to answer it, and they will be able to clarify it. Um, and as well as there are um, tutor assistants or teaching assistants, which are, they are available as well. I was personally TA for a few of the courses, and usually it would be after 5 o'clock or whenever the day ends. But you have all the support, not just from the professors, but as well as from the students, or the upperclassmen or your fellow classmate. Um, so someone is always there if you need um, some sort of help or some sort of assistance, and there's nothing wrong for asking for help. There's nothing wrong with it. If there is anything that you're not sure of, if you're not clear of, you should always ask someone. You should always go to a professor or an upperclassmate or a fellow classmate. But you should not just be like that. Something is, it's confusing, and that's it. No, you should always reach for help, because there is available. There is help available, and then you should seek it if you need it. I know when I was in Med One, or I'm in Med Two, I did go to TS sessions myself, the upperclassmates, and when I got in the semesters ahead, I expected if someone needed help to show up, and students did. So there's always help available. There's a 24-hour library there. Um, there's and with power, there's no you don't have to go through any troubles of anything like that. So there is everything available that you need, um, if you need any sort of assistance. Another question is, how does the MUA curriculum and professors help you with the step one? Um, like I said, when I started, they adapted the system-based curriculum, and it was really helpful for the preparation for step one. Um, Starting from semester one, whatever courses or subject that you take, end of every subject, you would take these shelf exams, which are basically the comprehensive exam of each subject. And if you basically put a time and effort to do well on these exams, um, and when it comes to Med 5, they do have basically a comprehensive review course as well, that is really helpful, and which also has its own shelf exams. So the school really provides you and challenges your knowledge, so you are prepared for that step one. Um, but they don't challenge you without providing you from the information. They provide all the information, and it's our responsibility to take the information in and apply it in these shelf exams, and then eventually the step one and step two, and so forth. Um, and so, like I said, there is a comprehensive exam, a comp exam, which consists of everything basically you learned for the um, first 2 years in basic sciences. And the comprehensive exam, there's a lot of stories out there. Even when I was about to start med school, I heard a lot of horror stories how students go through the whole 2 years and then not pass the comp. And it's not really depends on the class passing rate. It really boils down to you as an individual, and how have you done in last 2 years, how much time and effort you individually put in, because you will see the result. You will pass that comp. You will pass the comprehensive exam if you have done everything right and what you have supposed to do in the first 2 years. The comprehensive exam is difficult, and is supposed to be, because it is the exam to for you and for the school to know that where do you stand, and you do want to do well on this exam before you take the most important exam of your medical career, which is a step one. So I personally I feel great that they have a comprehensive exam, because that really gave me an idea of what to expect. I know a lot of other schools, they don't have such exam, and then when the student walks into um, such exams, they have almost like nervous breakdown and stuff. But going through these shelf exams and going through the comp exams, it gives you an idea of how the step one, the board exam, will feel like when you um, do get into that room. So I think for that reason, I personally did enjoy and did like these shelf exams and these comp exams, because it really helps you, um, and it makes you comfortable. You feel a lot more comfortable with yourself, with the knowledge that you have, uh, and it's all because the school really pushes it. School really pushes in the whole basic sciences curriculum for you to do better on all those subject shelf exams. So eventually, when the time comes for comp, you do pass it, and you do want to pass it, because that will guide you to the step one, which is, like I said, is your more the most important exam of the whole med school. Um, Another question that students usually ask um, is the interactive learning sessions. So there are cadaver labs, which you usually go through in your med one, which is anatomy. I know there are some other med schools in the Caribbean which doesn't have the cadaver lab. So personally, me and a lot of my friends, we did enjoy it, going to these labs, because what you can learn hands on, you can never just learn by looking at a book. So it's a whole different experience when you do walk into these labs and see it for yourself, what is what, and touch, and get the learning that way. There's also lab for clinical skills. So like I said, I'm a fourth year student right now, and clinical skill, or the step 2 CS exam, is very important as well, like the other board exams. And one thing I did enjoy, that the school started pushing the clinical skill aspect of the exam in the very first semester. They make, not just they teach you about the basic foundation of medical science, but they also teach you how to interact with patients. They have standardized patients, or they have patients that you can go and they will evaluate you based on the interaction that you have with these patients. And I think that was one of the a great benefit, because I just finished my step 2 CS a week ago. And I was really happy walking out of that exam, because, like I said, the school really does, push you from the get-go, from the beginning, to do well on everything, not just the weekly exams, but the end result. Um, and so another question they do ask is about the clinical rotation. So after finishing the basic sciences, and passing the comprehensive exam, the school does ask you to write a RLRA paper, which is the research, literature review and analysis paper, that you basically choose a topic, and to make an hypothesis, and you submit it to your mentor professor, and they basically tell you, what to pursue in that paper. And it was really, at first, I was a bit annoyed by it, but looking back, I feel like it was a great learning experience as well, because when you go into clinical rotations, you actually do read a lot of papers. You actually do present articles, and research papers to your attendings, and doing that LRA, it gives you that heads up, um, basically. So when you get into clinical rotation and someone asks you to present on this paper, or do this or that based on research articles, you already have some idea, of what is they want to know about and what they're asking. And also, there's a lot of statistical analysis that goes into play into these papers, which is a component of the board exams as well. So if you do the RLRA, the right way, and if you go through it, there's a lot of numbers and stuff that you will read and analyze, and it's a great exercise, because you will see those numbers, again, on board exams. Um, so I think RLRA is a great way for you to get into a little bit of a research aspect of medicine, and also analyze data and stuff. Um, and after the RLRA is approved, basically, you're assigned for your core rotations, um, which is consists of internal medicine, uh, surgery, psychiatry, pediatrics, obstetrics, and gynecology. So these core rotations are sometimes, it all depends on um, where you are, and which hospitals you end up going to. MUA does have a lot of. There are many hospitals in the states. I personally did my core rotations in Chabert Medical Center, Louisiana. I did my psychiatry in Maryland, at Shepherd Pratt, which is the sixth largest psychiatry hospital in the states, and it was a great experience. And then I did my OB-GYN in my on my home state in New York. So you get to travel, which I actually did enjoy a lot, because you don't really get an opportunity to see these many places and meet different people and work with different people if you don't have somewhere to be. And the school basically give you that opportunity to go somewhere, and and meet different people and work with different people. um, and what I think, which really helps you in the long run, and just as a person, I think it was just a really great experience, traveling wise. um, and when it comes to your fourth year, but before you go into your fourth year, you do have, same way, you have a comprehensive exam, followed by the step 2 CK. And just like in basic sciences, you have those shelf exams after each uh, subject or each class. In in your third year, after each co-rotation, you have the same way. You have to write shelf. And again, these shelf exams are a great way to challenge your knowledge. I know some med school, because I was with some students in other hospitals, that they actually don't make the student do these shelf exams, and I think it really hurts you in the long run, because uh, because you want to be challenged before you go and walk into these board exams. So after each co-rotation, you have a shelf exam, and after those shelf exam and after your all the co-rotations, you do have the comprehensive exam. And that's similar idea, just like end of basic sciences. Um, and also a great way for you to know where you stand and if you are ready, and if you are ready, how much preparation you need to do for the step 2 CK, which is the clinical knowledge part of the step 2 series, because you also have the step 2 CS, which is the clinical skills. After the co-rotations, you have the flexibility of choosing your electives. Where would you like to be? Where would you want to go? Um, so, for example, I am interested in going into internal medicine, and I'm doing sub internship in internal medicine rotation. I have a friend who's interested in surgery, so he basically got into sub internship of a surgical clerkship. So you have those options depending on the area of your interest. You can basically um, choose where you want to be. I have a friend who did a elective rotation at Harvard, and he successfully got a residency in anesthesiology this year. So the MUA really does provide the platform for you to succeed, but it does all comes down to you as an individual, how badly you want to do this, how much passion you have for the career that you want to pursue. Um, it's not easy. I mean, if becoming a doctor was easy, then everyone would try to pursue it. So it's not something that can be done overnight or a week or 2 weeks. It's a long process, but thinking back, it's actually hard to believe that that I started 4 years ago, and now I have 4 months left. I graduated in October. I have a last four rotations left, and it's it's long 4 years, but it's really fast paced. So the time really flies by. Even though you think it's 4 years or 2 years on the island or this and that, but it's so fast paced that it almost feels like a blink of an eye. So it is it's a great experience going through the whole 4 years. So in July I have emergency medicine rotation scheduled, and then followed by sub-line internal medicine, and then I'm doing nephrology, and then I'm gonna complete my clinical year with family medicine. Um, so it has been a great journey, and I'm gonna say it like the whole med school is like a roller coaster. There is ups and downs. There's a time of excitement. There's time that you're scared. Um, but just like the roller coaster ends, med school ends too. And I'm excited that I finished my um, board exams, and I feel satisfied with what MUA has provided, and it seems like they do a lot more than actually I expected them to. Um, there's always those things that might annoy you, or you might not be okay with or comfortable with, but you have to look at the bigger picture. And if you just um, look at the bigger picture and your goals and the dreams that you have, then those little annoying things or something that you're not comfortable with, then don't won't matter. Those things won't matter. Um, and personally, that's what I try to do. Um, every day is a new day, and every day there's something to learn. Um, and you keep that mentality forever as long as you live, I would say. But but there is something, new to learn and achieve every single day. Um, and basically, I just want to end by just saying that if you are interested in going into MUA, it is a great school. Personally, I've heard a lot of horror stories and stuff like that in the Caribbeans. But personally, I had a great experience. I met great professors. I met great friends. I made great friends, and it's the experience of a lifetime. And if you have any question, you can send me those questions. If anything you have in mind about basic science or about clinical science, um, I'll be willing to help if anyone needs anything. But MUA is a great school, and it's a great platform for any student who is passionate about medicine and about healing people and about learning, because you have to be open. You have to be open to the environment that you will be going into, and the the vast amount of information and knowledge that they will make you learn. So you just have to go in with an open mind, and just treat every day like a new day, and in the end everything does will work out. But you will have to put the effort to. MUA gives you the platform, but you will have to work to earn what you want, and it's doable. um, I know a lot of students in my class are already practicing residents right now, um, and I hope the same for myself, for next year in July. So we'll see how that goes. But if you have any question, I'm on Facebook. You can send me a text or a message, um, and I'll be more than happy to answer any of those questions. Thank you.